Well, good morning, everybody. I'm in Glasgow in Scotland at the moment, so it's morning time for me, but I know a lot of you are back home in Melbourne. Thank you so much for inviting me to speak today, Jess and Nikki. It's a privilege to be here, and it's really nice to be back on Zoom. I've been on a bit of a winter break, so nice to be back teaching again. And I'm really excited about diving into a few of the common winter ailments that our horses can experience. And I'm also really looking forward to hearing from Dr. Mel and Jess all about mud management. So without further ado, let's dive in. So what I'm going to be covering today is just a little introduction to who I am, because I'm sure there are a few new faces here and it's really lovely to meet you. I'm going to be going through thrush, hoof abscesses, mud fever, and then I've got a little bonus gift for you all at the end. So for those of you that don't know me, I am Dr. Lizzie McCready. I'm an equine vet. I'm currently based in Melbourne and working at a veterinary clinic part-time, 2 days a week, that specializes in horses. And then I also do my online business, Empowering Equine Education. Now, I've been a horse, dog and cat owner for about 20 years. Animals have always been a really, really big part of my life. So it was a very easy decision from a young age that I wanted to be a vet. I graduated from the Royal Veterinary College in London with honours back in 2016, and then I have worked in a variety of practices, both in the UK and Australia, both within an equine hospital, which is where I was back in Kent, and also as an ambulatory vet. So in the car, driving around, seeing horses as part of first opinion practice. I've got a very holistic outlook when it comes to health and horse health, especially. So I trained in traditional Chinese veterinary medicine and acupuncture back in 2022. And then it was in 2021 that I founded Empowering Education, Equine Education. And I started my first online training called the Equine Emergency Training. And I'm over the moon to say that I've had almost 200 owners come through that course now. And it's great to be having such a big impact on not just the horses that I get to see in clinical practice, but also horses from all over the world. Now, I've been an educational speaker in a variety of ways, both at Equitana, on multiple podcasts, and also in my in-person workshops. And my overall mission is to really inspire, empower, and educate horse owners, and through that, elevate horse health, well-being, and welfare. So I hope there's a few of you here that can resonate with that. So let's dive into winter hoof ailments, and I want to kick things off by talking about thrush. Now, I'm going to have the little chat box open so I can see a few of your comments as they pop up, but let me know who here has ever dealt with thrush and their horse. Now, for those of you that haven't and don't know what it is, thrush is a bacterial and fungal infection that impacts the frog. It causes degeneration, which means breakdown of the frog, and creates this black, foul-smelling discharge. So those horses with the really stinky feet. Now, it usually occurs in the central and the lateral sulci. So these are the deep grooves that run through the frog. And it often starts in the superficial layers of the frog, but in severe cases, the bacteria can actually progress down into the deeper layers of the frog and impact the sensitive tissues. Now, this can then lead to pain and lameness. Now, luckily, the horse has got a digital cushion, which offers a bit of a buffer, but if the thrush travels deeper than the digital cushion, it can even start to impact things like the deep digital flexor tendon, which we absolutely want to avoid. Now, thrush can affect just one foot or multiple feet. Often we see it in multiple feet at one time because it's often linked to the environment. So what are the predisposing factors? Poor hoof care is obviously number one. Then we've got poor hygiene in stables if the horse is stabled, or prolonged exposure to wet, muddy conditions if they're out in a paddock. Certain foot conformations will also predispose a horse to thrush, including having really deep sulci, so there's deep grooves, and also narrow contracted heels, because that can also deepen the central sulcus. And a lack of exercise is also thought to have an impact, because as the horse moves around, the heel expands, and that actually allows for the frog to naturally clean itself out with that movement. The common symptoms that we see are the signature black tar-like discharge that comes from the frog. So here in this picture, you can see it oozing from the sulcus. You can also find sensitivity when you're cleaning the frog, especially when you press into this central sulcus. That can either just be with your fingers, or if you're using a hoof pick, you might notice that your horse is flinching. We'll get a characteristic foul odor. It's one of those things that once you've smelt it once, you'll be able to detect it again for the rest of your life. And the frog could have a soft appearance, but it can be rough on the surface as well. And then when you're picking your horse's feet out, you might even notice that the frog starts bleeding, even just with sensitive touch. Now, in severe cases, so this is when the thrush has reached the deeper layers, we might also see lameness. Now, how do we treat thrush? So it's really important that you either get your vet or your farrier involved if your horse has developed any signs of lameness, because what we want to do is to get the vet or the farrier to debride away any of the diseased frog. Because if you're getting a topical treatment and you're just putting it on top of the frog, and there's disease deeper down, you're only going to be treating the tip of the iceberg. So we want to pare back as much as possible. This then allows us to access those deeper tissues for treatment, and it also allows oxygen to get into the areas that are affected by thrush as well, because the bacteria that causes it is an anaerobic bacteria, so it thrives in environments that have very low levels of oxygen. So if we can add oxygen to the area, it's naturally going to start treating it. Once we've debrided away the diseased tissue, we then want to start cleaning it thoroughly using an antiseptic. So this is going to treat the bacteria and the fungi that are there. So either using iodine or chlorhexidine, both in a solution. You don't want to use them concentrated. Then you'll be using a topical treatment of some form. I've got some recommendations in the next slide. Daily. It's really important that we are consistent with this to try and get on top of it as fast as possible. And you'll most likely be guided either by your vet or your farrier with regards to what to use. And then I know this is sometimes easier said than done, and I'm hoping Mel and Jess are going to be going to be able to give us some really good tips. But we want to try and keep the hooves dry and clean as much as possible during the healing process. Now, this might mean that if you've got a horse who's standing in a muddy paddock and you don't have anywhere on the property to take them, it might be worthwhile moving them to a different facility just so they can be on box rest for 2 weeks so we can really get those feet dry. Because unfortunately, if they're just standing in the same environment, there's no amount of treatment that is going to be able to fix the problem. Then once we've ticked all these treatment protocols off, we then really want to be looking at those environmental factors. So wet and muddy paddocks or dirty stables. Now, there are lots of topical treatments when it comes to thrush, and it really depends on who you ask with regards to what the best is. But here's a selection of the top that are based on farrier and vet recommendations. Now, ideally, we want to use something that is going to disinfect the foot. So it's going to fight the infection. It's going to desiccate the foot, which means it's going to dry it out. And we also want to harden the frog as well. So those are our treatment intentions. Now, my two favorites are going to be betadine or chlorhexidine. So betadine is the iodine, and you use them as solutions. And these have got really broad spectrum antimicrobial and antifungal properties. Now, you should ideally have both of these sitting in your home emergency kit because they're fantastic for wounds and any form of foot trauma. So they're very accessible and something that you can use daily. Copper sulfate solutions are another antibacterial agents that are very, very popular that can also reduce the microbial load in the hoof. I see farriers using these quite a lot. I don't use copper sulfate personally because I tend to use one of the top two, but I know it's also very popular. And then if we have a severe case of thrush where it's affecting the deeper layers and we're worried about the horse either becoming lame or they're already lame, then we want to be looking at using metronidazole. So this is a strong antibiotic that we use in those severe cases. So this would be under the guidance of your vet. Now, there are other natural products. Like I said at the start, I love ideally balancing a holistic kind of approach to health with our horses and trying to reduce our reliance on drugs as much as possible. So these natural products, these would only be used really in mild cases or in those cases where you're trying to use it as a bit of a preventative. So they contain things like tea tree or turpentine oil. And one of my favorites is the Leovet Frog Medic Spray. So this has got the turpentine, the tea tree, and the pine heartwood extract. And it comes in a really handy bottle that's got a very thin nozzle. So it allows you to really get into the crevices of those sulci, a little bit like the WD-40 bottles that we have. Now, in all cases, prevention is always better than cure. So what can we try and do to stop this from happening in the first place? So daily hoof cleaning practices are essential, especially if you can get a wire brush and gently clean out the sulci. That will allow you to get really good airflow and removal of the debris that can accumulate in those areas. Then ensuring that your horse gets proper hoof trimming and shoeing is also key, because we don't want them to be shod in a way that is going to encourage the heels to become contracted. I see that quite a lot. Sometimes you'll see shod horses and you lift up the bottom of the foot and the two ends of the bars, they almost look like they're about to start touching. So we really want to make sure that we've got a nice open heel so that we don't get that contraction. If the horse is stabled, it's really good if you can muck them out daily so that they're standing on clean, dry bedding. And if they're out in a paddock, we really want to try and reduce the time that they spend standing in wet and muddy areas. Now, one slide I just wanted to pop in was about canker. So canker is something that can occasionally get confused with thrush because it's not as well heard of, but it's actually a very different condition. It also affects the frog, but instead of being a degenerative condition like thrush is, it's a proliferative disease, which means that it causes an overgrowth of the tissue around the frog. Now, it commonly causes lameness, and unfortunately, we don't know the exact pathogenesis or exactly how or why it occurs. But we think that there could be a link also to that anaerobic bacteria that we're going to be finding in those muddy, wet environments, as well as potentially a virus called bovine papillomavirus. So again, something just to keep an eye on your horse's feet for. And if you're noticing any changes associated with the frog that you're not sure about, definitely get your farrier to look at them or get your vet out as well. Okay, and there's a few of you saying that you've experienced thrush in the past, but this year's been the worst. Yeah, I was speaking to the ladies before we started, and apparently it's been very, very wet and cold in Melbourne, so I'm not surprised. Okay, let's jump into hoof abscesses. So hoof abscesses are pretty much my bread and butter as an equine vet. I see probably a couple a day when I'm out on the road. And often we do get them more so during the winter time, especially when we're getting those fluctuations in weather where we're getting the wet and the dry days. It just tends to be the magic formula for the creation of hoof abscesses. Now, a hoof abscess is a localized infection within the foot. It's often caused by bacteria that enters in through either a crack, some form of puncture on the sole, or even secondary to a bruise. Now, they often occur within the white line. So this is that little line that travels just on the inside of the hoof wall that you can see in unshod horses. But if a horse has got a shoe on, it will obstruct the white line. And this horse actually has got a little defect just under where my toe arrow is on the white line. And when I took this photo, I thought, ooh, this horse might get an abscess. And lo and behold, 2 weeks later, he went lame with one. But they can also occur underneath the sole. Normally, if there's been some form of trauma to the bottom of the sole, so if they've stood on a tough stone or something like that, it's enough for the bacteria just to get in and start to cause an infection. So this is where they tend to start, but where they can burst can vary. So they ideally will burst around the white line if we can get them early on. Some of them will travel underneath the sole and even kind of go for a real wander about and cause a defect under the sole that we have to pare away. Some will burst out of the heels and some will burst out of the coronet band. Ideally, we want to try and encourage them to come out of the bottom of the foot, because if they travel up and burst out of the coronet band, that's then going to affect the hoof as it then grows down from the coronet band later on. Now, the risk factors when it comes to abscesses are wet conditions that soften the hoof, poor hoof conditions, so any horses that have got chronic cracks, or if their hooves have got too long and they start splitting, and horses walking on hard, uneven surfaces that cause bruising. Now, the symptoms of a hoof abscess, the classic one is your horse coming out and they're on 3 legs, so that real sudden lameness. Now, the lameness can vary. Some horses will only be mildly lame if it's in the early stages, but some horses will be physically non-weight bearing. I've come across countless owners who have called me up to say, I think my horse has broken their leg. We go out there and yet, lo and behold, they won't put any weight on the leg, but it just turns out to be a pesky hoof abscess. And I always think of it as a really nasty blood blister that you could get under your fingernail, and just how sensitive that is to pressure. If your horse weighs 500 kilos, there's so much force just going through the foot. So I can only imagine just how uncomfortable it is for them when they get that pressure build up between the hoof wall capsule and the laminae where the abscess is formed. Now, an elevated digital pulse in one leg is another key sign. And it's one of the reasons why I think every single horse owner should know how to take their horse's digital pulses. Because if you've got a horse that's suddenly going lame or is looking a bit shuffly, if you can locate that the digital pulse is in one leg, that's going to give you a better idea there's an abscess. Whereas if you're feeling it in multiple legs, it could be something more akin to laminitis. Sometimes you can also feel heat in the affected hoof wall as well. And sometimes there'll be some swelling either around the coronary band or actually extending up the pastern. So again, I get called out a lot for horses that have gone lame and they've got swelling around the pastern, and the owner just jumps to the assumption that, oh, they must have sprained the pastern area or there must be an issue in that area. And actually, the lameness is just secondary to the horse not moving around as much, because naturally, fluid that's in their lymphatic system, that gets pumped back up to the body from the lower limbs when the horses move. But if they're lame and they're trying to rest the leg that's got an abscess, that's going to reduce the movement in that area. So all of a sudden, fluid starts to pool towards the bottom. So the swelling isn't a concern. Once they're more comfortable and they get moving around, it tends to go away on its own. Now, occasionally you'll see pus discharging from the abscess site if it's already burst. So this is more common if it's burst around the coronet band. And some horses, I kid you not, you will not even know that they've got an abscess, but you'll go out one day and you'll see that they've got a really dirty, crusty coronet band with some pus oozing out of it. And you'll think, oh, I never had an idea that they actually had an abscess. And then another key indicator is if we have pain when we're using hoof testers as well. So again, something that I love teaching horse owners how to do is how to use hoof testers, so that if your horse pulls up lame on a Sunday night and you're thinking, do I need to get the vet or do I not? At least you can take the digital pulse and you can use your hoof testers to figure out, okay, is this most likely an abscess? If it is, I can probably nurse the horse myself overnight by putting a poultice on and giving them some bute instead of having to pay hundreds of dollars to get the vet out. So again, all just adds to the clinical picture, and it just allows you to try and figure out exactly what could be going on with your horse. Now, when it comes to treatment, it's best to try and get your vet or your farrier out to visit the horse as soon as you can, in order to assess the foot, make sure nothing else is going on, and to hopefully drain the abscess too. Often I'll get called out and the owner would have been treating their abscess for a week themselves and the horse will still be lame. And in fact, it's better just to try and get the vet or the farrier out so we can locate where it is, pare back that part of the foot and try and create a drainage tract, because otherwise the abscess is going to try and follow the path of least resistance, which means it might start traveling up towards the coronet band. And ideally, we want to avoid that. We want to try and encourage it to drain through the bottom of the foot. Now, you're going to be poulticing the abscess every single day. We want to poultice it daily so that we reduce the chance of the horse getting heel rubs, but also so that when we take the dressing off, we can look at the poultice to see, is it still draining or is it not? And you want to keep poulticing until the abscess has stopped draining and the horse is no longer lame. So here you can see I'm just putting on an Animal Intex, a little poultice dressing over the bottom of the toe. This one's wet at the moment, so I normally soak it in some warm water, apply it wet, and I keep using a wet poultice for a few days until I think it's stopped draining. Once it's stopped draining, I switch to just using a dry poultice. So I stop soaking it, reapply that, and I tend to continue poulticing it for 2 to 3 days just to make sure that nothing else wants to come out. And then you want to or bandage around the foot. You can go up to the mid-level of the pastern. I always make sure I'm using this elasticated adhesive, which is the white stuff that can go directly on the skin. And then I always reinforce the bottom with duct tape. And I love doing a nifty trick called making a duct tape circle, which is where I pre-make my duct tape into a circle shape. So when the horse's leg is lifted, I can just pop it straight onto the bottom of the foot and secure it around. It's really good when you've got a horse who's slightly fidgety or uncomfortable, which the majority of them will be if they're in pain from a hoof abscess. Now, in between your poulticing, it's good to either try and flush out where the hole is to try and remove any debris, and to spray it with some form of antiseptic. So either an iodine solution, or there's an antibiotic spray called terramycin spray, which is pink eye spray. It's made by Zoetis and you can buy it over the counter. It's the blue one. So I tend to use that a lot for hoof abscesses as well. And you can, if your horse will tolerate it, give them an Epsom salt foot soak in order to help draw out the infection. And so you use about 3 litres of water to 2 cups of Epsom salt, and you can just pop their foot in there. I tend to use like a shallow kind of feed bucket, pop the foot in there, leave it for 10 to 15 minutes, and that again will just help draw the infection out. Now, pain relief for these horses is important. I remember growing up, the farrier would always tell me, nope, you shouldn't use pain relief because it slows down the process. And granted, it will interfere with the body's natural inflammatory process within the foot, which is trying to clear the infection itself. But for the horse's welfare, we really need to have them on pain relief, because if they're sore, they're not going to want to eat. Their gastrointestinal system is going to slow down. That's going to put them at a higher risk of getting colic. So really, I think pain relief is a cornerstone of hoof abscess therapy. But it is important that they're not on pain relief, or at least bute, for too long. So you want to start them off twice a day, probably for only the first 3 to 4 days, dropping it down to once a day for another few days after that. But if a horse still needs bute for longer than a week, I'd be getting the vet back out to reassess them, because it could be that the abscess has traveled to a different location and maybe it needs draining again, or there could be something else underlying. We absolutely don't want these horses staying on bute for 3-4 weeks plus. If we do have a horse that needs to be on extended anti-inflammatory pain relief, we can think about swapping them to a medication called Prevequine, which is slightly gentler on their system, especially their digestive tract. Now, a lot of owners will ask me, why aren't you putting my horse on antibiotics? They've got an infection in their foot. And I say, yeah, the logic's there, but we don't use antibiotics for hoof infections. We just treat them, we get them draining, and the body is very good at sorting out the rest of the infection. Antibiotics in this case would be kind of a misuse of the antibiotics. We do need to try and use them as sensibly as we can. And also it'd probably end up just slowing down the healing process. The only time we do use antibiotics in a hoof abscess is if we're worried that the infection has traveled deeper into the foot and has actually started to affect the bone. Then it's a bit of a different story as of that point, but that's when we start to bring antibiotics in. And during the healing process, it's really important that you keep the area clean in order to avoid recurrence. A big pitfall that I see is that a horse gets an abscess, it gets drained, the horse is doing really well, you poultice it for a few days, you think, fantastic, their lameness has gone, I'll just turn them back out into the paddock. When they go back out into the paddock, the defect, the hole that was created by draining the abscess, that gets impacted with mud again. And next thing you know, you've got another abscess on your hands. So what I tend to advise is getting some cotton wool, just taking a little bit off and soaking it in some concentrated chlorhexidine, and then just plugging the hole with that. And that way that will just keep the dirt out. You do need to check it daily to make sure it hasn't fallen out. But if it has, don't need to panic, just give the hole a wash, add some more in. And you ideally want to keep that hole plugged until the foot has grown out and you no longer have a defect there that can harbor dirt and debris. And now I've got another warning when it comes to treating hoof abscesses, and this is with regards to your technique for poulticing. Yes, there's lots of different ways to do a poultice, but some of them can end up in a way that's going to really, really put the horse out. You know, an abscess might take a week to treat, but heel rubs like this could take months to come good. So an incorrect technique would be doing your poultice too tight, or letting the horse move around so that the poultice is slipping, or letting the poultice get wet and then it's staying on the horse as well. That's why it's so important to change it daily. Now, horses that have got low heels are far more prone to getting heel rubs. So you can see here, this horse has got virtually no heel. And this means that the heel bulbs are more so in contact with the ground and creating greater friction, which is what's leading to the rubs. But it's also important that you don't use vet wrap, so the colored stretchy material, directly on the skin. I see people doing this all the time. Vet wrap itself can rub, so it's always important that you have a layer underneath, so either like a soft band, or you can just use a nappy if you want to. And then when you do want to attach your poultice material onto the skin, you use your white elasticated adhesive, because the stickiness on that is okay to be in contact with the skin surface. When you're pulsing your horse's feet, also just monitor them closely to make sure they're not going soft and going red, or that they're developing any sores. And if you can, try and confine the horse to reduce their movement as well, because the less they move around, the less likely they are to get a heel bulb rub. Now, with regards to prevention, it's important that you try and keep the hooves dry and clean. Again, so much easier said than done. I understand that, but that would be our ideal intention. And then I think just monitor your horse's hooves regularly. Ideally, check them every day for any wall cracks, any white line separation, or any defects in the sole. Regular hoof trimming and maintenance by farrier is key. A lot of the time I see hoof abscesses in horses' feet that have simply overgrown and overdue a trim. And if you've got a horse, especially one with thin soles, using protective footwear in muddy or rocky environments can also help to reduce the chances of the sole getting bruised and that leading to a hoof abscess. Now, if your horse is getting recurrent abscesses, here are a few things that you should be thinking about. First of all, are you getting a reinfection from the previous abscess site? If you are, plug the hole. Has your horse got damaged hoof wall that's then predisposing them to abscesses? If so, get in touch with a remedial farrier. If you've got a horse who's getting recurrent bruising from thin soles, try wearing boots. If your horse is a little bit older and you're worried they could have a reduced immune system, get them tested for PPID or Cushing's. And if you've ticked off all those boxes and you're still scratching your head, it could be an underlying issue such as a keratoma. So I always suggest that the horse gets their foot x-rayed if the abscess isn't improving or if the lameness is severe. So this was a case that we'd been treating for about 2 weeks. We found a site of the abscess, we pared away, the hole was surprisingly big and it went quite deep into the foot. And the horse would come good, we'd turn him out, he'd look fine, and then he'd go hopping lame again. So we were going through this cycle for about 2 weeks. And then we got to the point where we said, do you know what? We just need to x-ray and have a look inside. And when we did, what you can see here is the pedal bone. And normally this should have a nice smooth contour. And you can see on this edge, we've got a little bite that's been taken out of it. Now, this is actually quite smooth, which means that it's unlikely to have been infection in the pedal bone, because that's one thing that we do see. Instead, it looks like this horse has actually got a lesion that's growing inside the hoof wall and has been putting pressure on the pedal bone, causing it to resorb, so to reduce in size. And then that has led to an abscess forming. So this is called a keratoma. This requires the horse to go to surgery, have a general anesthetic, and they actually remove, or actually I think sometimes they do it under standing sedation with lots of local anesthetic blocks, but they will then remove this keratoma from the hoof and then allow the hoof wall to grow over. But yeah, just goes to show that if things aren't adding up, or if you're finding yourself just going around in circles, ask for an x-ray if your vet hasn't already prompted you to do one first. And let me know in the chat if anyone here has already heard of a keratoma. A few of my existing students will have, but yeah, let me know if anyone else has. Okay, then I want to touch on mud fever as well. So the technical name for mud fever is Paston dermatitis, but it's got lots of other layman terms like greasy heels, scratches, and it's a skin infection caused by Dermatophilus congolenis and possibly some other species of bacteria and fungi too. Now, it affects the skin around the pastern, the fetlock, and it leads to scabs and sores, which can be painful for the horse. Now, Dermatophilus congolenis is actually a normal inhabitant of the horse's skin, but during repeated wetting or damage to the skin, it can then lead to infection. And it's the same bacteria that causes rain scald as well. Now, mud fever can become a complex syndrome in chronic cases with multiple contributing factors. So it's not always as simple as just treating the bacteria. Now, the classical symptoms will be scabs and crusty lesions over the lower legs, with some swelling and redness of the limbs too. Now, you might have some oozing exudates. That's normally like the thin yellow serous fluid, or pus when you remove the scabs. And the horse is going to be sensitive when you either feel around the area, and especially when you try to pick the scabs off. Now, in severe cases, but only rarely, we do sometimes see lameness as well. Now, for treatment, it's important that all scabs are removed. So it might be that you actually need to get your vet out to sedate your horse and to remove the scabs during that initial treatment. Then we can clip the affected area. Now, it's really important that when you're doing any of these things, especially around your horse's lower legs, and if they're not sedated, that you stay safe. So I suggest wear your hard hat. I've been kicked in the head before during a freak accident. It wasn't even when I was trying to do a veterinary procedure, so it can happen. So make sure you're just trying to be safe and you're just conscious of where your body position is. You can always ask a friend to lift up your horse's front leg as well for you if you want to try and just kind of immobilize them kindly. So once you clip the affected area, this is really, really helpful. And I don't see many people doing it if I go out to then see a horse and they've already been treating the mud fever. But the reason why we want to do it is because it makes it so much easier for the treatments that we then put on the leg to actually come into contact with the lesions and the things we're trying to treat. It also helps in the removal of crusts or scabs and the ability to monitor the progress of the condition so we can assess the response to treatment and also pick up on any new lesions that might have popped up. And it also makes drying the area, which is key, quicker and easier. So once you've clipped the area, then you want to soften the skin and the scabs with warm soapy water. And then you want to give it a thorough clean with an antiseptic solution. So my favorite for this is either chlorhexidine or Malaseb. So Malaseb contains chlorhexidine. Again, you can just buy it from pet shops. A benefit of the Malaseb is that it's slightly less drying than the Chlorhex. But with both of them, it's important that you leave it on for 10 minutes. It's a medicated wash, so we need to give it a chance to do its work. And during that time, you can get a soft bristle nail brush and you can gently scrub around the scabs to try and soften them too. Once the scabs have been removed, then you want to rinse off your antiseptic solution and dry the area carefully. Now, you can either use a clean towel or some disposable paper towels. If you're going to use a fabric towel, it's important that you use a new one each time. You can't just have okay, this is my drying my horse's legs towel and you use it 10 times before you wash it, because that's then going to start harboring bacteria. So it has to be clean each time, which is where the paper towels can be a little bit easier. Now, with the mud fever treatment, after that, we're going to be applying our topical treatment. So these will be generally recommended by your vet, ideally. My personal favorite is Predniderm. So it's an antibacterial, anti-inflammatory, and moisture-repelling product. And ideally, I'd be applying it twice a day to try and treat a horse's mud fever. After that, it's really key if you can try to keep the horse's legs dry. So again, avoiding turning them out into muddy areas until it's healed. If you don't have the capacity to do that on your property, it might be that you've got to move them elsewhere where they can just be stabled for a short period of time. And then repeat the process. So anytime new scabs pop up, you've got to remove them. I'd be giving it a wash daily with the chlorhexidine. If the skin starts to get a little bit dry and start cracking, I'd back off the washes, but I'd make sure I'm definitely applying the Predniderm twice a day. Now, just as a little note, effective management becomes much more achievable with early diagnosis and prompt treatment. Often, horse owners attempt various treatments on their own before consulting a vet. However, seeking veterinary help early on can significantly reduce the severity of your horse's condition and shorten its duration. So often you're going to get to the finish line far quicker. Now, if your horse's mud fever is not improving, it could be that there's either another issue going on, or maybe it's not actually mud fever itself. So it could be due to another condition that can present in a similar way called immune-mediated vasculitis. With these horses, there is no amount of topical therapy that you can put on them that's going to fix it. They often have to go on systemic steroids. In the horses that have got these long feathers, sometimes they can have feather mites as well. Classically, they'll be stomping the ground and they'll be quite itchy. And photosensitization is another one that I see quite a lot, especially in Australia, more than I used to in the UK, because we've got such strong UV rays. And these are those horses where you're out in the middle of summer, there's not a single drop of mud to be seen, but your horse has got mud fever. So it's probably actually photosensitization instead. Again, it presents in quite a similar way with the thick scabs, but it's due to sunlight causing inflammation in the skin. And in these horses, it's only the white, unpigmented areas of skin that are affected. And with the photosensitization and the immune-mediated vasculitis, sometimes it can start extending further up the leg and affect the cannon areas as well. So again, if you're not seeing results, or if it doesn't fit the typical picture of it occurring in winter in wet conditions, it could be something else. Now, as a little warning, if left untreated, Paston dermatitis, any of those that I've just listed, can lead to something called cellulitis. So cellulitis is a severe infection of the deepest skin layers, which causes swelling, and sometimes it goes all the way up the extent of the limb, lameness, and also a fever. Now, cellulitis is serious. It needs to be treated at the earliest possible point, and it requires intensive medical treatment, most often just at home, and systemic antibiotics as well. So we don't tend to use systemic antibiotics for classical mud fever. We'll always try and treat it from the outside first, but if it gets severe enough and starts to lead to a cellulitis, that's then when we bring out the big guns and put them on systemic antibiotics. So my little takeaway tips for this class is, first of all, proactive management of your horse's environment is key. There is no treatment that is a good substitute for a great environment, really. And often a bit of bit of inconvenience early on to try and get your horse's environment to a point where you're going to try and prevent these conditions as much as possible, that inconvenience at that point is always going to be less than you having to deal with trying to managing one of these conditions if they arise. As a good habit, I think it's always great if you can clean and inspect your horse's hooves every day. Make sure you're cleaning out those central and medial and lateral sulci, and just run your hands over your horse's legs, and especially the lower legs to check for any scabs that might have appeared. Schedule your horse hoof trimmer. I know they're as rare as chicken's teeth at the moment, to make sure that your horse's hooves are in optimal health. And if you do notice something going on, just involve your vet early on instead of trying multiple different treatments yourself first. If your horse is presented with a lameness, it always warrants a veterinary visit. And if you're not seeing an improvement, it's an indication that it's time to investigate further. And again, with the decline in kind of specialist equine vets that we've got at the moment, it's always going to be, well, it's not always going to be, but there's such a key place for you as an owner to be your horse's advocate. And if you feel like you want to do more investigations, don't be afraid about bringing that up in conversation and saying that's what you want to do. Because sometimes if you've got a vet who's a little bit less experienced, or maybe if they're a mixed practice vet and don't see a lot of horses, some of these conditions might not be on the top of their radar. So it's great if you can then open up that conversation and say, what about this? Or can we try that? So yeah, I think it's really important for owners. And then just to wrap things up, as I mentioned at the start, so my main focus to date has mainly been teaching horse owners about emergency care and first aid. So to help set you all up for success, I've put together a 16-page guide containing some of my best tips for emergencies. And you can download a copy of it for free just by following that QR code. And I believe, luckily, Jess is going to also just pop the link in the chat box too. Once you've downloaded the guide, it's also going to add you onto my email list, which is where I share case studies and horse health advice on a weekly basis. And I'm actually going to be dropping a new case study lesson with a video tomorrow, and also sharing a special offer for my signature equine emergency training course. So now's a great time to get on the list and to get this guide at the same time. So there we go. Thank you, Nikki, Jess, and Mel. Looking forward to the next part of your presentation.
Thank you, Lizzie. I'll just, can everyone hear me?
Yes.
I'll just open it up if anyone wants to ask any questions. Jess, have you got anyone down there that wants to ask?
Thanks,
we've had a comment that the emergency course is amazing, but at the moment, no questions in the chat.
Great, wonderful.
I've got a question. May I ask one?
Yes, absolutely, Nikki.
We used to put on mud fever a long time ago, if we couldn't get Prediderm, or if it was too expensive, we used to mix sulfur with Vaseline, and that worked really successfully. So maybe the sulfur, I don't know if that's something that vets recommend, or if you've heard of it even.
I have heard of it. Yeah, I have heard of it. And again, it's one of those things where as vets, we don't tend to use it because we have access to the other products, but I have heard anecdotal reports of it being effective. I think with things like sulfur and even things like copper sulfate and people using like bleach for thrush as well, they're very strong products. So you've always got to be careful because they can be causative. So they can actually almost cause like a burning reaction. So if you've got like a deeper issue with it, like if it's a deep form of thrush, it can cause more harm than good. But yeah, like I said, like I have heard stories about it working really well, but I haven't used it myself in clinical practice.
Okay, I have another question if no one else has one.
Yeah, absolutely.
Sorry, I'm full of questions.
Yeah.
Also with mud fever, they're not likely to get proud flesh as it's healing, are they? It's not going to.
No,
very
unlikely. Exactly, because normally the lesions, obviously you get the scabs. When you pick the scab off, it's quite a superficial skin lesion. We only tend to get proud flesh when we've had a full separation of the skin, and we've actually, the horse has then got to produce granulation tissue in order to fill in the defect, because it's the granulation tissue becoming proud, like becoming exuberant, that creates that bulging. So very unlikely to happen unless you have a really big, deep lesion. You're not going to fortunately see it with mud fever. And it also reminds me at one little point, I'm not sure if anyone here has ever tried using barrier creams for mud fever as well. Again, in theory, really good. I think that sometimes Sudocrem can just be a great cheap option for applying onto the back of a horse's leg. But apparently, in theory, you don't want to over rely on barrier creams because the bacteria can get trapped between the horse's skin and the oil level of the barrier cream as well. So although they can be helpful, it's not a fail safe, and it's still important that you give the horse's legs a thorough clean every day and then reapply it, just so you can make sure that you're not letting it in potential infection and sit on the skin surface for too long.
Okay, we have a question.
We have a couple of questions in the chat, Nikki.
Yeah, I just saw them.
There's one that I'd missed, sorry. It's from Deb. Is there any benefit to doing regular foot baths like what you would do for sheep, like magnesium sulfate solution and such?
Yeah, I can remember those happening for sheep. I mean, I haven't heard of it being used in equine practice personally, but it could be, if you've got a horse that's prone to thrush, it could be an idea, you know, as a preventative, maybe if it's just kind of once a week. But I don't think there's any evidence out there to suggest how effective it is. So it would very, very much just be a trial and error. But maybe instead of doing a full foot bath, because again, that's going to encourage the foot to soften. And if that happens, you might then predispose them to getting an abscess. I would actually say just having one of those products that actually contains maybe like the natural combination of the pine wood and the tea tree, and actually just applying that directly to the central sulci, that's probably going to be better because it's more targeted towards the frog instead of trying to soak the whole foot.
Great. There's a couple more. Pink eye spray for severe thrush.
Yeah, so that's the terramycin spray. Yes, I looked into that as well because obviously that's one of the things that I have in my car quite regularly. And at no point is terramycin, so that active antibiotic, is that actually advised for thrush treatment. So it's probably because it's a very anaerobic bacteria. But yeah, so we tend to go for metronidazole instead, or just sticking to the general antiseptics.
And another question about thrush. If treating it with chlorhexidine, should it be diluted?
Yes. Same with thrush and iodine. It's important that you dilute both of those because when they're used as concentrated formulas, they can again be caustic. So they can actually cause burning to the foot, and that can be very dangerous if the thrush has gone deeper into the foot as well. So yeah, absolutely diluting them. Lyndall, I'd use it as the same concentration as what you do for a wound. So you should have that hopefully written on the front of your bottles.
And the last question, it's a good one from Sophie. Chronic thrush, what would be the Goldilocks approach or treatment?
So Goldilocks are the best one, gold standard. I would say, first of all, it would be removing the horse from their existing environment. I'd ideally be having them box rested, ideally on shavings, because the shavings can absorb as much moisture as possible. And then I would be treating the foot daily. I mean, it depends on how severe it is. If it's a severe thrush, I'd be going with metronidazole, so with the antibiotic. But if it's more of just a low grade but grumbling thrush, I would be going for iodine treatment every day. And then waiting until it's fully cleared up. Once the frog's gone hard again and there's no longer a smell, then the horse can then go back out into the paddock. But really, it's about getting them off the mud and out of the wet.
That's it for the questions, Nikki.
Okay, thank you, Lizzie.
Nikki. Wonderful. I'll stop sharing my screen.
So, thank you, Lizzie. Thank you for that. That was very interesting.
Nikki, can I ask a question?
Oh, yes, certainly. Go ahead, Ingrid. Sorry about that.
Hi. I was just wondering about the boots. You said about wearing boots. I've tried different boots, and I have some horses who will just stand there and remove them immediately, like walk up and take them off. Or they, 2 hours later, they're lost. Like, has anyone had any success with that? It really frustrates me.
Yeah, I wonder if people can pop their recommendations into the meeting chat. That could be helpful because again, having come from the UK, my horses were always shod, and then I came over to Australia, far more horses are barefoot, and we're walking on trails which are really rocky. So the use of boots is far more common here, but I've never had to buy a pair myself. So it'd be good to know if anyone's got any personal recommendations that they can share.
Okay, and then my other question is, I've used copper sulfate quite a lot, and what's the best material to use it with? I've tried everything, but if you used it with something like a hoof oil, would the fat stop the copper working on the fungus, or what's the best carrier?
Good question. I'd probably have to ask a farrier to get because their recommendation on it, but because I think I've seen some people use like a cotton wool and they almost like soak it with the cotton wool and then pack that into the central sulcus, because obviously you want something that's going to stay in place. Like you said, I don't know whether the oil would end up interfering with the chemical process. What else have you used in the past, Ingrid?
I've tried tea tree and apple cider vinegar and that sort of stuff. I used lamb's wool instead of cotton wool because lamb's wool is hydrophobic. I had better success with that, I felt.
Yeah, exactly. And did it stay in place quite well?
No.
It fell out. And this is one of the things, is that if it can last 24 hours, that's all you need it to last, because really you want to be replacing it every day anyway while you're in that treatment phase. But yes, and there's a few people saying that 50-50 betadine and meths copper sulfate in Vaseline. Okay, so apparently people are recommending Vaseline as well. Okay, and Miriam,
that's
who I know
oily
is a
though.
vet as well. Yeah, Miriam, who's a small animal vet, the best response she's seen is daily treatment. Okay.
With what?
Yeah. With the which treatment are you talking about, Miriam? And there's one, has anyone here heard of Thrushbuster? Because that's a product that yeah, Lyndall's saying yes, which used to be very, very popular. It contains
formaldehyde.
Gentian and violet. Yes, it's been banned in Australia, and Canada. It's still available in the US, but it's the active ingredients believed to be carcinogenic and quite toxic. So definitely stay away from that. Okay, so Marian's saying, yeah, copper sulfate in cotton wool. So yeah, that's her recommendation.
Thank you.
Amazing. Perfect.
Any more
And then
questions? Sorry.
I don't think we've had any. Oh yeah, Janet saying, I use scoot boots and haven't had a problem with them. If you go through deep mud, there's always a possibility they will be sucked off the hoof. Okay. And which boots have you used, Janet? So it'd be good to know a brand.
I think she's saying scoot boots, isn't it?
Okay.
Yeah, Scoot Boots is the brand. I also use Cavallo. Cavallo are a solid boot. So I prefer Scoot Boots because you actually don't have that weight. And if you go through water and that sort of thing, it's easier to drain, for the water to drain. I haven't had any problem with them coming off, the Cavallo boots. So, but my horses are always barefoot. So if I go endurance riding, that's the ones that I've used.
Okay, amazing. And Omi's saying Scoot Enduro, and then Tracy's saying Oregano. Is Oregano for the thrush, Tracy, or is that a type of boot? Because I know oregano oil is quite antibacterial as well. Wonderful. All right, well, I think we could keep talking about thrush and boots until the cows come home, but I'll let you guys move on to mud management.
Thank you, Lizzie. Thank you for that. Okay, our next presenter is going to be Dr. Mel Archer, and also Jess Lai will be dropping in during that chat as well. So thank you, Mel, off you go.
All right. So I'm not a vet, I'm a medical doctor, and my only qualification for talking about this topic is that I'm a horse owner and I've battled the mud just like you. But I'm lucky enough to have a brother who is in commercial building and builds very large projects. And part of his job involves mud management on sites with heavy machinery and very large commercial drainage projects. So he knows a heap about it. And I would have to say that a lot of the technical stuff that I'm going to talk to you about is his knowledge, and blended it with my knowledge, just trying to battle the mud in various scenarios. So what we're going to do is we're going to give you a couple of general principles, and we are also going to give you a couple of case studies. I'm just trying to, there we go. So we'll start with general principles. And really and honestly, the gold standard for mud management is prevention. This is easier said than done, but it really echoes a lot of what Lizzie's been saying. Prevention or early treatment is what you need to do. And so many times, and it's not our fault, we try to manage the mud when the horse is bolted, and it's so much harder. So when you are trying to manage your mud, drainage work is traditionally done in the warmer months. So it's a really best done thing in the summer. And the reason for that is that the ground is dry and stable. Okay, so you can see what you're working with is one thing. And the second thing is that anything that you put in place into the earth is going to have a chance to bake hard, and then it'll be ready for action in the winter. And it means that you're not working with a sloppy medium, you're actually working with good, hard, settled soil. And that's why you traditionally do this in the warmer months. I personally, when I've had to dig out my own little chicken scratches without machinery, when I've been trying to put in hand spoon drains, what my little trick is to use a mattock. And I'll do it in the end of summer or in the autumn. And what I'll do is I'll wait for a little bit of rain, you know, when you get a day or so of that just softens up that hard ground, so that I can use the mattock to dig my little drain where I want it. And then I just enlarge it every time it rains, and I let it set and let it set. And that's how I do it. And then they work really well in the winter. But that's my sort of little quick management, less than ideal drains that I've had to put in adjustment. Sometimes you just don't have a choice. So we'll talk about a few more sophisticated things in that, though. The other thing that's an important message, and Jane and Stuart Myers say this, is that mud is the flip side of dust. So where you see the dust in the summer is where you're going to see the mud in the winter. And this is really important because this helps you to predict where you might need your drainage work. So it can help you. You'll often end up identifying a problem in the winter and then getting around to it in the warmer months. But if you can actually recognize where you're going to have a problem before you have it, then you're ahead, if you understand that general principle. Okay, so how does mud form? Mud takes two steps, basically. So the first thing that you need is runoff. And runoff is more water than your land or your drainage system, whether you've got some sort of subsurface drainage, something along your driveway or under your paddocks, whatever you've got. You get runoff when your land, as in the vegetation and the soil in your land, or your drainage system cannot absorb the water, and then it starts to run, right? And that's runoff. Now, the more flat artificial surfaces that you have, the more runoff you're going to get. So if you've got concrete, if you've got pan, if you've got a driveway, if you've got an arena, if you've got roofs, this is all going to contribute to runoff, because obviously the water's going to just come straight off that, and it's going to need to go somewhere. It's not going to have a chance to drain into anything. It'll come off those artificial surfaces and it'll go where it goes. Now, the next thing for mud, so it's all right if the runoff just keeps going, that's great. But when you get mud is where you get standing water. And the conditions you need there for standing water are if the water can't float, so if there's some sort of barrier to it flowing, or the ground just can't absorb it, or it can't evaporate. So the two things that will evaporate the water are wind. So we all know if we've had a lot of rain, we got some mud, we get a really windy day or a few of them, and it dries the paddocks up beautifully. But the other thing, of course, is heat. We all know that. The other thing, though, that's a bit of an invisible worker is the vegetation. So you'd be amazed by how much grass will actually suck up of groundwater. And the kinds of grasses that really suck up the groundwater, so not every grass is created equal in this respect. So annual grasses and semi-aquatic grasses are really shallow rooted, so they're not going to do much. But if you've got the kinds of grasses that are very deep rooted, so that's the perennials, so things that live for more than a year, and some of those really water hungry things, like some of the native grasses that can have root systems that can go down for a couple of meters. So it's pretty incredible to see cross section, and you'd be amazed how much water those things can actually move out of the soil. The other thing, of course, that will do it is big trees, and they have incredible pressure just going up the trunk, and on a sunny day, they'll move an incredible amount of water also out of the soil, and you'll know that instinctively, that where you've got lots of trees, you often have very firm ground because of the roots and because of the amount of water they take out. So these are the things that create standing water. When you don't have the vegetation, the water can't evaporate or the water can't move, hence you have mud. It's pretty simple. Now, this is a little trick. So if you want to understand your problem, because the key to really controlling mud is analysing, like a lot of things, is understanding what's creating your problem if you can. So go out on a rainy day and have a look. And it's best to see it in action. You can still read the erosion channels after the rain, but on a rainy day, you can see it all in action. So I've just taken a photograph here. And what this is showing is we've got runoff creating an erosion channel. This is actually my driveway being built. So this is one of the underlayers. And what's happened here is you've got this nice little erosion channel coming down a hill. So that's where the water's flowing. And here we have it fanning out, and here's our standing water. So we know we've got a problem there. So we're going to have to do something about it. And it tells you that that's the situation. I mean, this is all being built. There's going to be a drainage system going in, but this is an example for you. You'll see this at work everywhere. If you start looking and get the eye, just look for these erosion channels, where it's going, where it's coming from, and you'll understand your property or your environment if you do this enough. Another thing to understand is that mud formation is linked to, I've mentioned drainage, but I want to emphasize that this includes the grade or the slope. That's another way of saying slope of the land. So one of the main moving forces, of course, for water is gravity. It moves really well under gravity. We can channel it, which is a good thing about water. And one of the best ways that we can channel it is with slope. And so the grade of the land is really important. The vegetation cover or lack thereof that I've mentioned. Geology is a biggie. So you need to understand your soil, whether you've got clay, which can actually hold a fair bit of water and act as a bit of a barrier, or you might have sandy soil where the water disappears. I'm going to talk a little bit about my very special soil at my place as well, for those who have the joys of granitic soil. But you know, your geology is a really important thing. You need to understand it if you can, to understand your problems if they're on a bigger scale. Disturbance, of course. Now, that's because it churns up the vegetation, it churns up the top layers of the soil, it destabilizes everything. So we all know those high traffic areas where the horses walk, like laneways, are the classic for where the mud will form. So you really just need to know, if you're going to fix your problem, where the water comes from and why it's trapped. It's kind of as simple as that, even though it gets really complicated sometimes. Those are the principles. So there are small scale problems and you may be able to fix them yourself. I certainly have fixed a lot of my own little problems, and I'm sure we all have over the years, but what we need to understand is we may do really well and our little fix might last for years and it might be adequate to deal with the problem, but actually we may just be doing a patch-up job that's possibly better done by a professional if we want it done properly. It may be suboptimal, but if it works, it works. If it does what you want, that's great. There are also large-scale problems, and usually they're things that we can't fix, and we may need a professional for that just because they've got access to heavy equipment, materials, and know-how. But, you know, maybe you have those things too. Maybe you can just hire the machines, maybe you know, and buy the materials you need from the garden centre. So there's really no one answer. Every situation's different, but just understand that sometimes you're doing a patch-up job and it may be better done by a professional, but maybe you can do what you need to do yourself. So I'm just going to hand over to Jess. I'll change the slides for her, but she's going to talk about this case study here.
Thanks, Mel. Okay, so I'm also not an expert in landscaping and mud management, but we thought it would be interesting just to supply a couple of different case studies. In my case, I don't have the horses on the property with me. I'm on quite a large agistment. We've got 47 horses on the agistment across around about 100 acres, and they're split into 3 herds of varying sizes. So for each of those herds, because we have so many horses across the property and often horses coming out at peak times before work and after work, we do get a lot of mud build up in those high traffic areas. So such as those tie-ups, gateway areas, wash bays, and the entry to the arena area. So I've just put a picture on the right here. This is just a very normal tie-up area for us during winter. The mud is actually quite deep here. It probably doesn't do it justice, but particularly those areas where you have horses feeding, it's not great having them standing in the mud for an hour at a time. And also, in particular, the gateway areas and the gateway areas that I'll show you in a minute is quite a narrow gateway area. You can get slipping risks. It can get a little dangerous. You can get your foot stuck in the mud. One particular gateway, which is the case study for these slides, is one where I've slipped over in the mud myself and ended up with 2 hooves on either side of my head. Doing some mud management around that gateway area was a big priority for me. We also, because we're at an Gippsland and the land is leased, we have a bit of a, we can't make changes that are irreversible. So when we talk about managing our mud, we have to manage it in a way that we can really take out any infrastructure that we put down. So if you just go to the next slide, please, Mel. Thank you very much. So what I'm going to present is just a little case study where our main area where quite a lot of the horses from 2 herds convene is an area where we have a row of pens. Pen 1 on this diagram up here is on the uphill slope. It's a gently sloping hill that leads down to a laneway area that leads out to one of our big paddocks, which is on the left of that diagram. And then down the bottom, on the other side of that laneway, still heading downhill, we have pens 2, 3, and 4. Historically, we had a lot of water running down the one side of pen 1, and you can see that in the picture here. You can see a bit of a furrow running down the edge of the pen. There's a lot of grass build up there, but in winter it really starts flowing with water. And then that water would spread across the laneway, causing a lot of mud build up, and then out into pen 2, leading to quite a lot of runoff down the edges of pens 2, all the way down to pen 4. It was a bit like a waterfall effect because each pen was lower than the other. So to get the pens in order, but also to make the laneway more safe, we decided to try a couple of tactics to reduce the erosion in the laneway and the pens, and also to reduce the mud. So if you just move to the next slide, please, Mel. Thanks. So, if you just flick back 1, thank you. So just to show you, the brown areas on the diagram were where we were having a lot of the mud build up in pen 1 and the laneway especially. So next slide, please, Mel. Thanks. So the first thing we did, and very much experimenting here, is down the bottom of pen 1, we decided to put a little rain garden in. So we just, we'd had a tree that was chopped down. So we just used the stumps of the tree to build up a little garden bed, and we planted some local leptospermum species just to see how they would do. They're water loving or wet loving species, and they've done quite well there. The next thing we did was we looked at our runoff in the paddock, where the water was coming down through the paddock and intersecting with that laneway gateway area. And we took a few logs from that tree, and we built a swale in the paddock to capture some of that water runoff. And I'll show you a picture of that in a moment. Third thing we did was we started experimenting with geohex with the intention that if it worked here, we would start deploying the geohex in other areas around the property. Next slide, please, Mel. So just some pictures. So you can see on the left here, sorry about the noise in the background. You can see on the left here, the swale in the paddock. We did actually plant a few plant species. They didn't do too well, unfortunately. I think it's because our soil is a little acidic, as a lot of horse properties are. So we're still experimenting with those plants. You can see the bottom left picture here. That's a picture of the laneway. So unfortunately, I didn't have a before photo of the laneway, but it was very muddy through that gateway. We laid down geohex in the laneway and then out into the paddock. So I'm standing on the paddock side from that photo there, and it's done very well. It was laid down over 12 months ago, and we've had 2 winters with it, and it hasn't failed. We've been able to keep that area mud free. The rain garden's also doing quite well. We've managed to limit the amount of runoff going down through the laneway and into the subsequent pens. And the other thing that we did before laying down the geohex was we built a drainage channel First, we laid down some gravel along the drainage channel, and then we laid down some ag pipe, sleeved ag pipe that led into that little shelter belt down below, which is actually lined with swamp gums. So far, that's actually been a bit of a game changer for us in terms of the mud management during winter. Next slide, please, Bill. So just a couple of other case studies from around the property that we've been doing just slowly over time. Tie-ups and wash bays have been two areas where we've laid down more geohex. So you can see on the left-hand photo, I've got a tie-up with no geohex. It's quite muddy. I don't have a before and after photo, but this tie-up is very close to the tie-up on the right, where you can see geohex has been laid down. It's quite useful because not only it keeps the area more dry, but it's also a lot easier to clean the area after someone's been feeding hay or hard feed. And on the right, you can just see we've got a wash bay in the paddock. We didn't have an option to lay down concrete, so we put down some geohex, and you can see on the bottom there, just in front of the geohex, it's quite muddy. That's how the wash bay would usually be. But in the middle of winter, just last week, we can still use a wash bay perfectly fine. And there is a drainage channel underneath with ag pipe also, which leads down the downhill slope. You can see in that little picture there, which is covered by fine gravel. I think that might be the end of my slides, Mel, so I'll hand back to you.
Yeah, I think it is the end of you. So let me just change to me. Yeah, so I'm going to just do the next case study, and I'm just going to talk about my muddy paddocks. And this is my property from the air, or from Google Earth. And this was a place that I bought in 2022. And the main paddocks are mud during the winter. So these ones here, there's a paddock here, which is actually really nice. But these ones here are mud during the winter, and they go rock hard during the summer. And the grass in there is really unproductive and stressed. You can see that red color, and it doesn't grow particularly fast because it's all really waterlogged, and it's quite semi-aquatic all through this central area here. What I'll just draw your attention to, though, while we're looking, is some features I'm going to talk about. So this 4-bay shed features in it, and this dark stain is runoff going onto that paddock from that 4-bay shed. This little tiny thing here is a tiny little dam that came with the property. And the next thing I want to show is a view from the top of those paddocks. And this is the beginning of just trying to analyze this problem. So I don't even have the horses there yet. They're still in adjustment. I'm still preparing this property, which is not a horse property, for the horses, putting in all the infrastructure. And it's just been a lot, but we're getting there. So analyzing the problem in terms of what's causing these muddy, boggy paddocks. So you think in terms of, all right, what structures might be contributing? And you can't really see it very well, but up the middle of the two main paddocks is a little dividing fence that was really old. And that was one of the things that was creating standing water. So the water coming downhill was hitting a mound of soil that had gathered basically in front of that fence. So you know when you've had a fence there forever and it's chronically just washing soil down, and over the years they grow a little mound in front of them, and then there's vegetation that goes over that. And that's what had happened there. So it was creating a barrier for the water coming down the hill. So that was one big problem. But an even bigger problem was runoff. And look, there's a main road at the top of the property, but that was minimal because there's good drains that go with that road, and also a line of really big mature trees along the road that was sucking up a lot of water. So the environment up there was actually really dry. But what you can't control, and what's just a normal part of life, is that because this is hill country, there was a property even above mine across that road, and there's a lot of, because of the properties of the soil, underground water that's probably coming from that property, just in the natural way of water moving down the hill. So nothing that those neighbours are doing wrong, but that's just the way it is. But the other significant problem that is under my control is that big 4-bay. So there's nothing to catch that water coming off the roof, and it was a significant amount that was pouring off that roof and basically going in an undirected fashion onto the paddock. Now, the other part of analysing the problem is the environment. So I have granitic soil, which is throughout my region, and it's quite interesting. It's decomposed granite, and it's almost like quicksand when you dig it up. It's really amazing stuff. And they talk about through this whole area of Upper Beaconsfield and Narre East, where I live, where this soil is quite endemic. They talk about these underground springs, and this is an example. So my brother got bogged in the paddock, and after I dragged him out with my 4-wheel drive, we went out with his excavator and dug this hole, which is about 1 metre deep. And within minutes, because we just wanted to see what is going on under here, and within minutes, it actually started flooding in. It was like running a bath. It was incredible. So within about 10 minutes, we had this much water in the bottom of the hole, and this was midwinter last year. So that's just the way granitic soil is, especially if that water can't move and it's trapped, which is the big problem I have here. The other thing is dips in the land. So when you look over the land, if you look at my paddocks, it's hard to appreciate in the photo, but this sort of central portion here, the whole thing looks kind of like a sunken cake, and you'll know this look from paddocks when you look across them, and there's sunken bits in the middle. So dips in the land are holding water. There's very few trees. You can see this is a really cleared big paddock. Apart from around the edges, there's not much growing there. And I've got these annual semi-aquatic grasses. I've got an acidic, nutrient-depleted waterlogged soil, which is only suitable for aquatic grasses like paspalum. So it's just going round and round and round. So until you drain it, it's not going to get better by itself. The other thing, I just want to pass on this tip. Use Google Earth a lot. So I actually heard this. I went to the Yarra Valley Equestrian Landcare event at Tanya Meldrum's, and she was a big advocate as well of using Google Earth, and she uses Google Maps, I think it was. Anyway, she loved looking at the change over time on her property, and you really can see a lot from this satellite imagery. You can see grass color differences that tell you where the wet bits are and the dry bits, and you can look at features, you can measure things, you can do lots of cool things in Google Earth. So use that. But another thing that was kind of an accidental discovery, my brother's got a drone, and he flies it up over the property sometimes. And one day after mowing really closely, we had a bit of a revelation. He saw these stripes. You could see these vertical stripes that are running down the property towards this little dam thing. And what it was actually back in probably up until about the 60s or 70s, it was old orchard country, and there's still a lot of orchards around, and they grew and still grow apples in my district. And this property, after just doing a little bit of tracing around, would have been an old orchard. And what you can actually see are the rows and what goes in between. So you can't appreciate this at all from the ground unless you know it's there, and then suddenly you go, I can see it. You can see these dips and humps in the land that are holding water and acting as a barrier for the water coming across to go towards the dam. And because of the way that the whole thing was originally put in a quite sort of willy-nilly fashion, the water was missing the dam anyway, because there were big berms that had been built in the incorrect spot. So you can just imagine that the whole thing had a lot of problems with it that just need to be relieved. So the solutions are actually speaking to neighbours is really handy, because they were the ones that explained to me about the granitic soil, and they also explained some things that won't work in our area or things that they tried. So just talking to some people on my road with particularly successful, lovely properties, it's so interesting hearing what they say about the things they've done that haven't worked and have worked, and just hearing their insights into the land. And you know, for example, I was told to avoid subsurface drainage, which was something we were going to try because it silts up because of the granitic soil. I mean, who knew, you know, unless you get that local knowledge. Redirecting water from the forebay and the paddock to an enlarged dam, so that the course of the water has been changed with a big spoon drain, and the dam's been enlarged, and it's still got to be enlarged a bit more. Tree plantings to be done to soak up some of that water, especially in the wet bits. Limiting runoff. So I'm going to install tanks on all buildings, and you know, so you might as well catch that runoff and put it to use and stop it from getting there in the first place. And some drainage for the pan and all the driveways. So proper subsurface drainage will be fine for those, to direct that out onto the road in the normal fashion. And removing that dividing fence that was trapping the water, and then using a rotary hoe to flatten it out, to get rid of that hump. Filling divots in the land with soil and smoothing is something that's a bit experimental that we're going to try. We may find that there are some bits that we can't get on top of, so we'll just work with the land and make an ephemeral wetland. People do that with some success. I've seen that on a few properties now where they just say, oh, can't control that bit, so I'm just going to make it into a lovely wetland with some nice habitat, and actually works well. Nourishing the soil and encouraging some deep-rooted perennials. Mulching with a flail mower is one of those things, and of course harrowing in horse manure. Using an equicentral system to rotate paddocks and get the horses off the problem areas, because I'm not naive enough to think we're going to fix this in 1 year, because we do need to have patience, because it's a very long game and every year is different. So just because you think you're winning in 1 year, you shouldn't get dismayed if you find that you're actually not the next year, because the different conditions all the time make it really hard to judge your progress. That's just life when you're working on a big scale like this. And I find it quite handy keeping a multi-year diary, because you'll inevitably forget what things were like last year and at what time, and quite useful information. I use it all the time. So I'm just going to do a really quick case study just to round this out with, we've spoken about controlled mud work. So we're going to talk about when we're caught in an emergency. So sometimes we just get caught out by an injured horse, or a horse that, in the case of this case study, got laminitis midwinter, little EMS pony, and he needed to be yarded, and that yard had to be built around his shelter, and there was already mud around the shelter, and yarding the pony, of course, is only going to make that worse. So I'm just going to talk about this as a case study, and this is an example of a temporary job, okay? So this is not the ideal. This is just a quick fix that was done in an emergency. That's just designed to limp you through the situation. And also, every situation is different. So if you've got a Clydesdale that you need to be yarded, the following tips may not be ideal for you. Now, let's just start with, let's say you don't have access to machines and you just have to get this done. What you can consider is a quick and dirty approach, especially if you need to reverse it really quickly afterwards, like if you're on an adjustment. So there are things called mud mats. Some people use carpet as well, but mud mats is a commercial product, and Hahn Plastics is a local company that makes mud control grids, and you just literally throw them down in the mud and pick them up again when you're finished, and they stabilize the surface. GeoHex Jess has talked about. So, again, you can throw that down in the mud. It's not ideal, but you can lay it straight into the mud. I haven't tried that, but I've heard you can, and the product specifications say can. There are people who lay GeoHex professionally too, so if you're really in a bind, you can get someone to help you. If you have machinery, this is actually one of my brother's excavators, and it's one of my students playing around with it, but it's the only photo of it I had. But what I want to show you is the blade on this machine. So if you happen to have a machine that's got a blade on it, you can scrape back the mud to firm ground. That's what you really need to do if you can. There's usually too much for you to do it by hand, but you can give it a go if you're working in a small area. But it's just like the talk about debriding down to healthy tissue tonight from Lizzie. You have to debride the ground if you want to work on it. You need to get down, not to the dry ground, you won't get there, that's very deep, but you want to get to the firm ground and get that first layer of disgusting, stinking mud off, and work with something firm. So use the machine with the blade to just push it all away if you can. Just mound it up somewhere. You'll be surprised it'll go flat in the summer and grow grass, and you'll never see it again. We've lost some really big mounds of mud that we thought would hang around for years, and they just disappear quite quickly. Horses sort of stamp them down. Now, at this stage, you've got it all smoothed. Dig spoon drains as required. So you may need to dig some spoon drains now that you're down to that firm surface. Next thing is lay your surface. So something with fines. So road base would be the usual choice. Rake it smooth with a metal rake, just a garden rake or a big landscaper's rake to get that surface smooth. But at this stage, you also, hopefully before you started, you need to make sure that you've got some kind of grade or a slope is what I'm trying to say here. So if you don't have some kind of a slope, the water's just going to stand. So if you don't have a slope, you have to build one using the material that you're putting down or by pushing earth. You just need to have a slope. Otherwise, you're not going to drain it. This is a little hack that my brother uses. So now that we've laid our material and we've made sure we've got our grade, if you need extra strength, what he does is he just gets some cement mix, nothing fancy, just opens the bag and he sprinkles it on just like you're icing a cake. And you don't have to worry about, it'll sop up the water that's already there. you don't have to worry about it setting. It's an exothermic reaction, so it gives off heat. So it'll set itself. It's not like it needs time to dry. It just has a reaction with the ground once it gets wet. And if you have the Clydesdale, you know, that keeps sort of breaking through this over time, you just keep apparently sprinkling cement and stabilizing it until it's done. Wear gloves when you're handling it because it's corrosive, and glasses, and watch you don't breathe it in. But yeah, you can definitely put down cement dust, and don't worry about, you're not going to need a jackhammer to get it up either, because the horse will probably break it down over time, and all you really need is just a machine bucket, you know, or even some hand tools. So it won't go that much harder. It's a weak concrete that it forms. It won't get that much harder than your road base will go, but it'll just give you a bit of extra strength. The next thing that's really key is compacting it. So you can use the weight of your machine if you're lucky enough to have one. This little 1-tonner is what my brother used in this situation. It's not ideal, but he just track rolled it with the Caterpillar tracks because that's all we had. Some people use vehicles, or you can use a little machine called a whacker plate that you can hire as well, just to give some compaction. So that's how you build your yard. Now, some people say don't bother to scrape the mud, and you know that they've had success. And you know, as I say, there's not necessarily any one right answer. People have success doing all kinds of things. So you've got to do what works for you, but you can throw the road base or whatever you have down into the mud without scraping it. This is true, but here's the result. So this is this boot here is standing on scraped ground that was firm when that road base was laid, and this stuff here was just thrown straight into the mud, and you can see that that boot has sunk, so you don't get quite as good a result there. So it is worth scraping that mud if you can. So that's all I have to say. We have 3 local equine landcare groups. So there's us, the Cardinia and West Gippsland Equine Landcare. Then we've got our friends in Mornington Peninsula, and we've got our friends in the Yarra Valley. So look us all up on Facebook and consider joining one or all. We're all very linked, and we're all very friendly. So we hope to see you at some events. Our next event, which we'll start taking some bookings for soon, is about horse-friendly trees. So we're going to meet the people at the Speciality Trees Nursery on the 19th of October. So put it in your diary, and that's all I have to say. Thanks.
Thank you, Mel. Does anyone have any questions? No questions? Someone asked, I noticed that someone, can you all hear me?
I can, yeah.
Yeah, good. I noticed that someone asked that they're worried about their horse if they move too fast over GeoHex, that they might fall, and it's like a cheese grater.
Question. Jess, do you want to answer that?
Hasn't happened at our adjustment. I suppose anything is possible though. One thing that our tech officer, the amazing Dave, has done is after he lays down granitic road sand as a base, and then he puts the grids down, and then he fills the grids with, first of all, 14mm crushed rock. But then what he does after that is he spreads a layer of road sand over the top and road sand down the sides to create a slope off the sides, because sometimes, as if the geohex is there for a while, as it erodes away around the edges, the edges can stick up and can be a bit of a tripping hazard even, or hooves can get knocked against it. So he's really rounded out those edges for us. Haven't had a situation where a horse has slipped over on it so far, and hopefully we don't.
All right. Also, I've got some articles I'll put on our Facebook page. A few of them are from Yarra Valley Equestrian Group. I'll put them on in the next few days, and they've got some more information about mud management, and they go in a bit more detail, GeoHex and all that. One of them is about the property we're talking about, Mel, the one that we visited a while back. So people might find those interesting as well, but I'll put them up the next few days on our Facebook page. Any more questions, or else I'll end the night for everyone? No questions? All right. I'd like to thank everyone. Thank you so much for attending. Now, we love your feedback. If you want to give feedback, we'll put the details in the chat to our Cardinia and West Gippsland. What are we? Cardinia and West Gippsland Equine Landcare Group. Sorry, it's such a long name. Our email or our Facebook page. We love to hear your ideas. or any thoughts you have of future topics that you want us to hold. We want to hear from you. Yeah, but any questions we didn't get to tonight, or if you think of any, you can send them to us on our email or messenger or Facebook, and we'll try and put them in our next newsletter. And that's it. Thank you, Lizzie. Thank you, Mel and Jess. Thank you everyone for attending. And I hope you enjoyed the webinar. I certainly learned a lot. So thank you for that. Have a good night and see you next time, of course. Bye, everyone.